Hello, welcome to my YouTube channel, and in this second episode in English we will talk about reducing medication errors because medication error remains one of the most common causes of unintended harms. So in this episode we will talk about reducing and how can we reduce these errors. We will talk about it like any other philosophical question, and I will talk about what I have read about it, and we will treat it like any other philosophical question, not like practical solutions. Yes, we can talk about it and we can implement these ideas in real life with practical solutions, but rather than doing that we will talk about it like any other philosophical question because medication errors remains one of the most common causes of unintended harms. In 2011 there were over 30,000 deaths associated with medication errors, and in 2012, despite the fact awareness and efforts expanded to decrease medication errors, there was an almost 50% increase in deaths related to medication errors. So this problem remains really real danger to our society and our healthcare. As high as these numbers are, they pale when compared with another report says that over 90,000 people died because of medication errors. As high as these numbers are, compared to another research in 1999, over 90,000 people died because of medication errors. So we can't really know how many person died because of this, but we can imagine this is very important for our community. Another report in 2016 says that preventable medication errors affect more than 7 million patients with associated almost $21 billion yearly across all care settings. And if we are to look at these medication errors and in logical sense, we can see that there are some categories in these errors and we can categorize them and treat them as like math problem. So categories are administration to wrong person and wrong time, through the wrong route, wrong medication or dose, omission of medications. These are categories. We will be looking at this problem in this video. However, this reporting process is limited due to fear of consequences from reporting a medical error, which is the most commonly identified. However, reporting is limited because of fear of consequences at the subject. It is of great importance, therefore, that factors contributing to errors are discovered and dealt with to ensure safety of our patients and reduce the threat to a nurse's career. In addition to deaths related to medication errors, there are also estimated to be responsible for well over 10,000 complications and injuries every day, resulting in cost of more than $1 trillion yearly. So this is a real problem as we talked about earlier. Medication errors can occur over time, anytime, during the process of prescribing, transcribing, dispensing, administrating, and or monitoring of medications. So if we are to talk about adverse effect of administrations and related to these, if we are to talk about adverse drug events, as these errors doesn't always occur in death or injury, it is also true that as many as 1.5 million people annually experience harmful outcomes from a medication error. In fact, the increased risk of death associated with adverse drug events is almost twofold compared to that not associated adverse drug events. And researchers have estimated adverse drug reactions to be responsible for more than 100,000 deaths nationwide each year. Evidence supports that there is a gap in current healthcare systems practices regarding efforts towards and knowledge regarding strategies to reduce medication errors. In this part, we will talk about how should we look at this problem if we are to manage. To manage this problem, efforts should gear towards seeking ways to reduce the errors as much as possible because they can never be completely eliminated. And expecting an error-free performance is not realistic, considering the known information that 1 out of every 5 medications administered by nurses was in error. This was a research paper made in 2002. Any action that will prevention of minimizations of medication errors should be of relevance to nursing and remain a priority. In this section, we will talk about what are the problems about this subject that keeping us solving this. One of the problems is when errors occur and they are not reported, there is no opportunity to learn from the errors, so they will continue to be made and hidden while the patients bear the brunt as a result. With an increase in the numbers of drugs available, this is another problem we have. Nurses may experience unfamiliarity with certain medications, inadequacies in math calculations, stressors in everyday environment, lack of pertinent information about the patient, and potential equipment problems. Why we talk about these problems in like every mistake made by nurses? Because nurses, by virtue of their trade, make the most medication errors. We are not looking at this problem like a nurse's problem. This is healthcare's problems. And when we look at these problems, we should ask ourselves that what challenges are there to reporting medication errors and eliminate them, and what opportunities or challenges could influence the implementation of this educational project if we are to solve these problems. Because one of the report of these medication errors estimates from past research subject that hospitalized patients are subjected to at least one medication error per day. When these mistakes happen, the healthcare providers experience complex emotional responses, including devastation, embarrassment, and desire to conceal the mistake, shifting blame, and resistance to implicate other providers. When I read about this, I see that when we ask people open-ended questions, they often reveal surprising mental models, problem-solving strategies, hopes, fears, and much more. And solving this problem requires knowledge about how adults learn, and this is a subject of adult learning. And when adult learns, adult need to individualizations of learning strategies and require internal motivators much more than external motivators. And in adult learning, the learning has to be centered on life and tasks, and there must be an opportunity to function autonomously. So this means adults go to learning with deep ego involvement. In 1984, Knowles stated that adults need to know why they must learn something before they start, and they want to be perceived as self-directed. These knowledges about adult learning will be required solving these medication errors and reducing these medication errors. As we talked about this earlier, there is not error-free environment, but there can be less of these errors in real life, not imaginary world. Solution of these problems require just culture model can be used for creating and supporting a learning culture that is open and fair and focused on creating safer systems and managing behavioral choices. The logic model can be used to guide development of a plan for implementing the educational program. Adult Learning Theory by Knowles in 1984, which is based on premise that adults require certain considerations to effectively learn, can be used to demonstrate how using the adult's experience, orientation to learning, and intrinsic satisfaction can aid in avoiding education errors. And we should be look at this in emphasis on what went wrong and not who did. It is critical to achieving success in medication errors containment that mistakes are inevitable and most want to learn from their mistakes in an understanding and supportive environment. First type of behavior we want in this environment can be managed through training and changes in procedure. Here the person that made the mistake is supported and consoled just as just culture would demand. The second situation where the provider drifts from following policies and procedures, the behavior is managed through removing incentives for at-risk behaviors, creating incentives for healthy behaviors, and increasing situational awareness. And the reckless behavior is managed through remedial or punitive action. One event, however, should not warrant any disciplinary action or termination unless a pattern or history exists of medication errors or there is evidence of reckless behavior. And end of everything we have talked about in this episode, when mistakes happen, the healthcare providers experience a complex of emotional responses, including devastation, embarrassment, and desire to conceive the mistake, shifting blame, resistance to implicate other providers. So everything we have talked about in this video toward the environment with just culture and learning opportunities. I believe with what I have read in this subject, we can solve these issues not entirely, but reduce these errors and with just culture and logic model adult learning processes. So that's it. Have a nice day. See you all in my next episode.